Good afternoon and welcome to today's webinar, The Public Charge Rule and the Threat to Public Health, brought to you by the Network for Public Health Law and the American Society of Law, Medicine, and Ethics. I'm Charles Trong, the Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of this event. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select All Panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A session towards the end of the event. Your moderator for today's webinar is Leela Barraza. Leela is a consultant for the Network's Western Region Office and assistant professor at the Zuckerman College of Public Health. Her research interests include studying the impacts of laws and regulations on population health, both nationally and globally. Previously, Leela served as a fellow and adjunct professor in the Public Health Law and Policy program at the Sandra Day O'Connor College of Law at Arizona State University, as well as a deputy director at the Network's Western Region Office. Through her work with the Network, she has addressed over 100 technical assistance requests on various public health law issues. Leela will be leading us through the rest of today's webinar, so Leela, over to you.
Thank you, Charles. And welcome to all of our participants today for this great webinar. I'm going to introduce our three speakers and then pass it on, and we will do questions at the end of all of the speakers, the conclusion of all the speaker sessions. First, I'd like to introduce April Shaw. April is a staff attorney at the Network for Public Health Law Western Region and the research scholar at the Center for Public Health Law and Policy at ASU's Sandra Day O'Connor College of Law. She previously clerked for 2 appellate judges at the Arizona Court of Appeals. Most recently, she worked as a contract attorney at the Legal Services Center of Harvard Law School, where she assisted the project on predatory student lending with representation of the student class in the ITT Tech bankruptcy proceedings by performing complex document review and gathering evidence to support federal student loan borrowers' defense to repayment. Prior to becoming an attorney, she received her PhD in philosophy from the University of Colorado at Boulder. Thank you, April. And I'd like to introduce our second speaker for today, Holly Straught-Epsteiner. Holly is a Mellon ACLS Public Fellow and Research Program Manager at the National Immigration Law Center. Holly has a PhD in sociology. At NILC, she uses qualitative research and other empirical approaches to study low-income immigrants' lived experiences with policies in areas including public charge and workers' rights. And last but not least, we have Justin Lowe is our third speaker. Justin is the legal director of Health Law Advocates Incorporated and leads HLA's representation of vulnerable low-income consumers denied access to health care. Previously, Justin served as an assistant attorney general in the Consumer Protection and Medicaid Fraud divisions of the Massachusetts Attorney General's Office, where he led investigations and enforcement actions against unscrupulous lenders, debt collectors, for-profit schools, and healthcare providers. Before that, Justin worked at an AM Law 100 firm in Los Angeles. Justin is a graduate of the Boston University School of Law. Thank you to all of our presenters, and I will pass it now to April to get our webinar started.
Thank you so much, Professor Barraza. I'm so glad to be here today presenting with Justin Lowe and Dr. Holly Straught-Epsteiner. What I'm going to do in my presentation is to provide an overview of the public charge rule so that we can have a good foundation for our discussion about the rule later on at the end of the webinar. I'm also going to briefly discuss the legal status key differences between the final public charge rule and the old interpretation of public charge, and some concerns raised in the comment period to the proposed rule. So what is a public charge and why is it important? A public charge is an individual who is inadmissible or cannot adjust their status under the INA. And when I say that they can't adjust their status, that means, for example, that a person seeking to get a green card will be denied a green card. I'm actually going to focus just on green card applicants today because that's where we're seeing a lot of the public health concerns pop up with the final public charge rule. So why is it important? Well, obviously, overwhelmingly, if you can't get a green card, that's going to have a detrimental effect on the individual applying for the green card. But a lot of green card applicants actually apply for green cards through family-based immigration. So typically, they'll be an immediate relative, such as a spouse, child, or parent of a U.S. citizen, and the applicant is in a non-immigration status, such as on a student, work, or visitor visa. So the denial of a green card impacts not only the applicant, but it will also tend to impact the larger family unit, which includes citizens, LPRs, and others. The INA itself doesn't define what a public charge is, but it provides factors to consider under the totality of the circumstances. So before the final rule was implemented, the rule that was in effect, or I should say the definition that was in effect, came from the 1999 field guidance, and that definition will be still operative until February 24th. So under the field guidance, a public charge is an individual likely to become primarily dependent on the government for subsistence, as demonstrated first by either the receipt of public cash assistance for income maintenance or institutionalization for long-term care at government expense. So very quickly, receipt of public cash assistance for income maintenance includes, for example, supplemental security income or TANF cash assistance. And an example of institutionalization for long-term care on the government's dime is being placed in a nursing home at the government's expense. So why was this definition adopted in 1999? The field guidance wanted to propose a concrete definition of public charge due to confusion at that time regarding the use of benefits following changes to public benefits use that resulted from the Personal Responsibility and Work Opportunity Reconciliation Act and the Illegal Immigration Reform and Immigration Responsibility Act. So the PRWORA, for example, restricted benefit use by legal immigrants. So the problems that those two changes created was there was a lot of confusion about public benefits use, and that confusion deterred the use of health and nutrition benefits. So the goal of the field guidance was to address the negative public health consequences resulting from the confusion, which not using public benefits was not only bad for the eligible individuals who could use the benefits, but the field guidance also recognized that that was bad for public health generally. The goal was also to provide guidance on the benefits that would be part of the public charge determination. And so really, as you'll see, compared to the final rule, the lens in which the public charge determination is looking at benefits is much narrower. So only cash assistance for income maintenance, not other types of cash assistance, and institutionalization for long-term care. The field guidance also specifically excluded other non-cash benefits, and they cite three primary reasons. First, they said non-cash benefits by nature are supplementary, and therefore they're not indicative of primary dependence on the government. They also recognized that in other arenas of the government had made public policy decisions that made non-cash benefits available to families with incomes above the federal poverty guidelines. And the most recent example of that we can think of is like the Medicaid expansion. And they also recognized that by excluding non-cash benefits, they would promote their use, and promote public health. Just very quickly on the legal evolution, the final rule change was proposed in 2018. It was set to go into effect October 15, 2019. It was blocked by several district courts. Those injunctions were later lifted by the circuit courts, and the last nationwide preliminary injunction was lifted by the Supreme Court. So the final rule will now apply to applications and petitions submitted on or after February 24th, except in Illinois, in which a statewide injunction is still in place. So what did the final rule change? The final rule expansively redefines the meaning of public charge to include non-cash benefits relating to food and nutrition, housing, and health care. So under the final rule, a public charge means an individual who receives one or more designated public benefits for more than 12 months in the aggregate within any 36-month period, such that the receipt of 2 benefits in 1 month counts as 2 months. What that last part means, for example, is that if a person uses 2 public benefits for 6 months, that would count as 12 months of using designated public benefits. So why did they revise the rule? Basically, the goal was to ensure self-sufficiency and to ensure that people looking to get their green cards would rely on their own capabilities. And to do that, the final rule is looking at a broader spectrum of benefits. And the reason why the justification behind double counting benefit uses is that the final rule sees that multiple benefit use is indicative of self-sufficiency. So the more benefits an individual is likely to use, the more likely they are to be a public charge, even if those benefit use is very short term. So under the final rule, the immigration officer is now going to be thinking expansively about looking at all of these non-cash benefits. This is just a quick comparison of the benefits and a visual on how the list has been expanded. So we see that under the final rule, it includes all of the benefits in the 1999 field guidance, as well as SNAP, formerly known as food stamps, most forms of Medicaid, excluding, however, emergency medical, Medicaid by children under 21, pregnant women including 60 days after their pregnancy, and Section 8 housing subsidies. So how do you know whether or not someone is likely to become a public charge? As I mentioned, under the INA, it's a totality of the circumstances test. So what the immigration officer is asking is it more likely than not that the applicant will become a public charge at any time in the future? So by statute, the minimum factors that you have to consider are age, health, family status, assets, resources, and financial status, education, and skills. The final rule, however, adds a list of positive and negative factors. So, for example, if you're between 18 and 61, that's a positive factor. If you're younger than 18 or older than 61, that's a negative factor. Household size. If you have a small household size, that's a positive factor. A large household size, that is a negative factor. Education and skills. If you have, for example, a high school diploma or higher, that's positive. If you're proficient in English, that's positive. If you're a primary caregiver, that's positive. Obviously, if you're not proficient in English, that's negative. So, in addition to those factors, the immigration officer is also going to be thinking about the affidavit of support. So generally, someone applying for their green card has to file an affidavit of support because they're generally doing it through family-based immigration. And basically the sponsor, for example, the sponsoring U.S. citizen spouse, affirms the ability to maintain the applicant at an income of at least 125% of the federal poverty guidelines. Another consideration is that the immigration officer can consider all factors bearing on the applicant's ability or potential to be self-supporting. So the immigration officer is not limited to the factors listed above. Now, although there are these new positive and negative factors, we really don't know how they're going to play out. For example, say you have an individual who is 62, has a serious medical condition, and comes from a large family. That would be 3 negative factors. Is that sufficient to deem that person to be likely to be a public charge? What about individuals who have positive and negative factors? So an individual who's 19, which is positive, didn't graduate from high school, negative, limited English proficiency, negative, but they're healthy and come from a small family. Those are both positive factors. So there's still a lot of questions to be asked, and it's noteworthy that no single factor in this list should be determinative. The final rule also added a list of heavily weighted factors. So here there's 3 heavily weighted positive factors, generally having an income above 250% of the federal poverty guidelines, having private health insurance, excluding insurance obtained with the ACA tax subsidies. There's also a list of heavily weighted negative factors, such as being unemployed and not a student, or having a medical condition requiring extensive treatment, but not having insurance or resources to pay for reasonably foreseeable medical costs. Again, even though these are heavily weighted, they're not in and of themselves determinative. So after the final rule was proposed, a lot of organizations did some great work in trying to build a picture of what kind of impact is it going to have. So the Kaiser Family Foundation did an evaluation of all non-citizens who originally entered the U.S. without their green cards based on past studies, and they did a breakdown of what percentage of these individuals would have negative characteristics. This study only looks at people without LPR status. It doesn't take into account people that are ineligible to get their green cards or the differences in status. And we see that almost 80% have at least one negative characteristic. Over 20% had limited English proficiency. Almost 40% had no high school diploma. So I just want to touch upon some other additional concerns that were raised after the final rule was proposed. The first one is basically that it's discriminatory and that it favors the healthy, the wealthy, and the highly educated. So I just pulled a couple of examples, or numerous examples in the rule, but here's some examples that people raised. First is that the final rule discriminates against people with disabilities who disproportionately rely on non-cash benefits to maintain self-sufficiency. And because of that, people argue they're going to be disproportionately singled out by the rule. Other people argue that it disproportionately discriminates against people of color who also disproportionately are impacted by certain chronic conditions like heart disease and diabetes, which would be negative factors. The Migration Policy Institute also did some really great work on looking at the potential impact of the final rule. And what they did was they examined Census Bureau data to determine how people that had received their green cards within the last 5 years would have fared under the final rule, taking into account 5 of the negative factors listed in the rule, specifically having an income below 125% of the federal poverty guideline, being younger than 18 or older than 61 with a low income, having limited English proficiency, not having a high school diploma or equivalent, and not being employed or enrolled in school. And what they found was that the elderly would overwhelmingly almost automatically have 2 strikes against them, one for age if you're over 61, and one for not working. They found that because the elderly disproportionately are unemployed, that almost 72% had 1 or more negative factors. Similarly, for children, they're automatically dinged for age, And based on their research, they had higher rates of poverty, so that's 2 strikes. Also, with regards to women that recently received their green cards, they were less likely to be employed. However, there is a caregiver factor that was added to the final rule, which is a positive if you're a primary caretaker. Women also tended to live in larger households, and they tended to have lower incomes. As to the chilling effects, I'll just note those really quickly. Dr. Holly Epsteiner will go into more detail about that, but there's concern about how the final rule expansion will affect use of non-cash benefits. There were several health-related impacts that people raised about the final rule, specifically related to disenrollment issues due to the chilling effect. So it would undermine health insurance coverage, and, for example, by doing that, people would be less likely to utilize preventative services. And you can sort of go through the other examples that disenrollment might impact. Okay, so I wanted to wrap this up with some common myths because there is a lot of nuance to the rule, and one of the reasons that it might be having an impact is because there's a lot of confusion about the actual scope of the rule. So I think the best way to kind of understand how the rule works is to go through some of the common myths. So myth number 1, green card applicants will be largely impacted because they are currently using designated public benefits. This is false. So the majority of green card applicants are ineligible for designated public benefits such as SNAP and Medicaid because of the PRWORA. So as I mentioned, that law restricted benefits use by legal immigrants. So for a lot of these designated public benefits like Medicaid or SNAP, you have to be a citizen or a qualified alien. And a qualified alien, for example, includes people that have their green cards, and they generally have a 5-year waiting period after that before they can even use benefits like SNAP or Medicaid. Some qualified aliens are eligible to use public benefits right away, like refugees. However, as I'll get to in a second, refugees are not subject to the public charge analysis. So myth number 2, the final rule applies to all green card applicants. This is false. So there are listed examples of green card applicants that are specified in the final rule that are not subject to the public charge determination when they're applying for their green card. So as I just mentioned, refugees are not subject to the public charge determination. They're also eligible for public benefits. So it's important to be aware of the nuances in the rule and what the status is of the person applying for their green card. Myth number 3, the final rule applies to use of any free or low-cost food and nutrition, housing, or health benefit. This is false. It applies to the designated public benefits identified in the rule. Also, the rule lists several examples of these types of programs that aren't included in the public charge analysis, such as WIC, CHIP, and Medicaid-funded services or benefits provided under the IDEA. So it's important to be aware of what public benefits actually come into play in the final rule. And myth number 4, the final rule applies to anyone applying for U.S. citizenship and current LPRs. The public charge analysis does not apply to people applying to get their citizenship. And if someone is already an LPR, it doesn't apply to them. It only does so in a very narrow circumstance. So, for example, if you have your green card and you've left the country for 6 months or more, that's going to be a very narrow class of people. Thank you. I'm going to wrap up now and pass it over to Holly.
Hi, Hi, everyone. As Leila mentioned, I work at the National Immigration Law Center. NILC is a national organization that works to defend and advance the rights and opportunities of low-income immigrants and their family members, and we do that through policy advocacy, litigation, and strategic communications. And I should also mention that NILC is a co-chair of the National Protecting Immigrant Families campaign, together with the Center for Law and Social Policy, which is a campaign that consists of hundreds of organizations across the country working on advocacy, community education, and policy and legal analysis related to public charge. So today I wanted to share with you some research findings from a new report we have coming out early next week that touches on how immigrants are interpreting changes to public charge under the Department of Homeland Security rule, and that documents some of the harm that is already being perpetuated even before the rule has been implemented. So this research will be published early next week, and the report will become available on the NILC website. If people are interested, it's just nilc.org. So researchers have estimated that as many as 26 million people could be chilled from seeking health, nutrition, and housing programs as a result of fear and misinformation associated with the public charge rule. So even though, as April just mentioned, the number of people impacted by the rule, particularly through participation in public benefits, is actually not that many people. It's only a certain class of people who are impacted or subject to a public charge test. The widespread chilling effects are expected to be much, much larger. And so even though the rule has not yet been implemented, we know that chilling effects are already beginning to manifest. So for example, 2 months after the public charge rule was published in the Federal Register, the proposed rule, there was a national survey by the Urban Institute that found that more than 20% of adults in low-income immigrant families were already avoiding benefits programs. So the research that I'll be discussing today seeks to unpack some of these quantitative estimates of the chilling effect to examine what do these chilling effects look like on the ground, and how is public charge impacting immigrant communities and the people who work with those communities. So to examine these questions, we conducted in-depth interviews with service providers who work in immigrant communities, and these included a variety of service providers, so health and nutrition, benefits enrollers, advocates, outreach workers, healthcare providers, and legal services providers. So we have 24 providers in the sample representing 11 states. And all of the interviews were conducted during the period that the rule was proposed, right up until it was finalized. But of course, it has not yet been implemented, so all of the data are from the period before public charge was implemented. So here are some of the top line findings that I'll share with you today. First, as we heard in the first presentation, this rule applies only to individuals adjusting status within the U.S. to become lawful permanent residents. And even among this group, as April just described, there are some exemptions for humanitarian visa holders, refugees, and different groups. But nevertheless, the first finding I want to share is that public charge is creating fear among groups that are not technically impacted by the rule. Second is that whether or not people are actually targeted by the rule, there are detrimental consequences for health and well-being resulting from this chill, and people feel they must make unnecessary choices related to their health and well-being because of public charge. And then finally, I'll discuss briefly how this rule is not only impacting immigrants and their families, but also the service providers who work in immigrant communities. So the first finding, people who are not actually targeted by this rule are nevertheless chilled from participating in benefits. So really, the accounts from service providers really demonstrated the widespread spillover harm that public charge creates for immigrant communities and members of immigrant families. And that included people who are already lawful permanent residents or people who already have green cards, people who are already U.S. citizens, and that especially included the U.S. citizen children of undocumented parents or people in mixed status families, as well as evidence of chill among some of these protected groups that April described, so survivors of human trafficking and other crimes, so people like U and T visa holders. So among these groups, there were different concerns that led to chilling effects. First was uncertainty about the rule at all, about how it applied currently, or concern about how it might change in the future, and kind of a general tendency toward risk avoidance. People didn't want to risk any future chances of legal status. They didn't want to risk chances of becoming citizens, and so they had this tendency to avoid any kind of risk at all. These concerns came from misinformation that people were hearing about which populations were impacted, as well as which programs were included in a public charge test. And then also there were some concerns about sponsorship. So for example, we heard a lot of stories about people who feared that even though they already had status as a lawful permanent resident, they feared it could jeopardize their existing status or their prospects for citizenship. So one example is a woman in North Carolina who worked as a navigator enrolling clients in ACA marketplace coverage and Medicaid, told me that a lot of her clients who were choosing not to enroll in these programs were already green card holders. So she told me that one example was a mother who was a lawful permanent resident who was enrolled in ACA marketplace coverage. When she found out about the rule, which had just been proposed, she terminated not only her own coverage under the ACA marketplace, but also Medicaid coverage for her kids who were U.S. citizens. So this example shows that people understand, not only people misunderstand who is impacted by the rule, but also which programs, because, for example, ACA marketplace is not included in the changes under the public charge rule. And another example, an advocate told me about a trafficking survivor who had recently become eligible for public benefits through her T visa application, who was a single mom with 4 kids, and upon becoming eligible for food stamps did not want to enroll because she was afraid that she would be deemed a public charge when she tried to adjust status. So there are real consequences for the health and well-being of these people being impacted through these chilling effects. So providers identified some troubling implications for their clients and patients' health and well-being that they associated with fear of being deemed a public charge, in addition to other restrictions targeting immigrant communities. So providers talked about issues like growing food insecurity, lacking access to healthcare and coverage. So in Wisconsin, an advocate told me about a mom who decided to disenroll her kids from SNAP, even though she was already struggling to make ends meet and was already working 2 jobs. So the advocate told me when she canceled those benefits because of fear, she was looking for a 3rd job. So here we can see not only is this family at risk of greater food insecurity, but also a mom who's working 3 jobs, right, is going to have less time with her kids. What also came up in the interviews is that people felt like they had to make unnecessary choices. So one of these choices was people feeling like they had to choose between their current needs, so meeting their health and nutrition needs that they have in this moment, sacrificing that for future possibilities for legal status. And this was true even for people who, didn't currently have any pathway to legal status, giving up benefits for their U.S. citizen kids, for example. Another unnecessary choice was that some people had the misbelief that they had to choose between public benefits. So, for example, they thought they had to choose between keeping Medicaid versus giving up SNAP. So people would say things like, well, healthcare is a lot more expensive than food, right? So if I have to give something up, I'll give up food stamps. Medical care is too expensive. Really these decisions that no one should have to be making for their families who are eligible for these programs. So finally, I'll touch a little bit on what are the impacts for these service providers who are working in immigrant communities. Well, it creates a lot of burdens for these people. So first of all, time burdens. So these are service providers who suddenly are having to educate themselves about this rule, be in a position to educate their clients about the rule, overcome the misinformation they hear, and ultimately try to convince their clients to make the best decision for themselves. So in this example, Arturo, who worked at a federally qualified health center in California, was telling me that all of their appointments are taking a lot more time because they have to spend the extra time, first before the appointment even happens, kind of preparing, printing out, learning information about public charge, sharing that with the patient, and then basically convincing the person to enroll in the appropriate coverage or program, and convincing them that they're okay, that they're not going to be deemed a public charge because of that participation. So all of this is a drain on both time and resources, and for folks who are not necessarily trained in immigration law, right? There's also emotional burdens for service providers who care very deeply about their clients' well-being. People talked about wanting to let their clients make their own decisions, of course, but also wanting them to be able to meet their needs and their family's needs, and how this created a lot of frustration and stress, which really raises the question of burnout as well. So some of the implications of this research, first, it really shows there's a disconnect between the rule as it is written and the rule as it is perceived on the ground. So it really shows us that the impacts stemming from the Department of Homeland Security public charge rule are not limited to the people who are actually subject to it. They're also harming people who already have lawful permanent resident status, people who are U.S. citizens, children, vulnerable populations like survivors of violence and trafficking. And so, people really find it difficult to separate their own use of benefits with that of their family members or dependents. And it's impacting participation in programs that are not included in the rule. So, people talked about, I mentioned ACA Marketplace earlier, WIC also came up in some of the interviews. And so in a way, this is really kind of putting the onus of federal immigration policy on community organizations, hospitals, health clinics, creating these burden of service on service providers who do not necessarily have additional financial resources or time to cope with this burden. So, on the one hand, service providers who have expertise in benefits eligibility may understandably lack immigration law and policy expertise to advise clients or patients about public charge. And then on the other hand, immigration attorneys may lack expertise in benefits eligibility and may not consider the health implications if they're telling their clients to decline benefits for which they're eligible, which had happened in some cases that people were receiving incorrect information from their immigration attorneys. And then finally, it identifies some specific community education needs in specific areas that advocates can continue to address, which advocates are already working hard to address these things. So identifying specific areas of misunderstanding about who is impacted by the rule, which programs are considered by the rule, reinforcing that there's no distinction, no one has to choose between nutrition and health benefits, things like that. So there's a lot more to unpack in this research, and I hope that folks who are interested can read the report when it comes out early next week. And I will pass it on to Justin.
Hi, everyone. So thank you so much. My name is Justin Lowe. I'm the legal director at Health Law Advocates. I just wanted to start by saying we really appreciate being here and having the opportunity to speak with you all about this important issue. NILC and the Network for Public Health Law, they've been such great partners and have really been leaders in speaking out and talking about public charge, and NILC and the Protecting Immigrant Family campaign has provided leadership throughout the country on this and other immigration actions by this administration. So really appreciate all of your great work, and thank you to April and Holly for bringing us through a really helpful discussion on the background and the chilling effect, which is, I think one of the most pernicious aspects of this rule. I'm going to be turning now to discuss some of the main Administrative Procedure Act arguments in the pending litigation challenges around the country. So HLA is one of the organizations that filed amicus briefs in the district court and circuit court challenges to the new rule. We're really glad to welcome on 25 other organizations that signed on to our brief. As we'll discuss, our brief focused on the federal-state framework for health policy, and in particular, the really important role that local governments have to play in crafting healthcare policy. Here are some of the parties that signed on to our brief. They're comprised of national and local organizations, hospitals, health plans, academic and advocacy organizations, really a cross-section of the entire healthcare marketplace in Massachusetts and nationally. So as a quick refresher, April's already covered some of this, but I thought it'd be important to look at the law, right? The law where this rule comes from. So the public charge rule comes straight from the Immigration and Nationality Act. Section 212A4 of the Act reads, any alien who, in the opinion of the consular officer at the time of application for a visa, or in the opinion of the Attorney General at the time of application for admission or adjustment of status, is likely at any time to become a public charge, is inadmissible. And here are the factors that April spoke about that are to be taken into account in this determination. There's age, health, family status, assets, resources, financial status, and education and skills. 8 U.S.C. Section 1103 charges the Secretary of Homeland Security with the administration and enforcement of the immigration laws of the United States. And that includes in sub A3 the authority to establish regulations and to perform such other acts as he deems necessary for carrying out his authority under the provisions of this chapter. And prior to the new rule, the term public charge was really understood to mean primarily dependent on the government for subsistence. And this is the 1999 INS field guidance that established the definition of public charge, or really formalized it for consular officials prior to the new regulation. So to date, at least 8 lawsuits have been filed challenging the rule. These are in the federal district courts in states like New York, Maryland, Illinois, California, Washington, and the plaintiffs include 3 separate state coalitions, local cities and counties, and a number of nonprofit advocacy organizations. Here's the timeline tracking the major litigation events in the lawsuits filed by the state and organizational plaintiffs. Most of the plaintiffs filed suits soon after the final rule was published in August. In October, before the rule was first set to be implemented, the district courts in California, Washington, New York, and Maryland issued nationwide injunctions. Likewise, the Northern District of Illinois issued a statewide injunction. And soon after, DOJ appealed each of the preliminary injunctions and immediately moved to stay the orders. So the Ninth Circuit and the Fourth Circuit, these are the circuit appellate courts, granted the stays that DOJ requested, while the Second Circuit denied DOJ's request, and that kept in place the nationwide injunction issued by the Southern District of New York. So far, the Ninth Circuit is the only appeals court that's issued a written decision on the Administrative Procedure Act claims. As we'll see, it was pretty critical of the plaintiff's position. DOJ appealed the Second Circuit's denial of the stay to the Supreme Court, and on January 26th, the Supreme Court sided with DOJ and stayed the Southern District of New York's preliminary injunction. That decision cleared the way for the rule to go into effect everywhere except in Illinois, where, as April mentioned, there's still a statewide injunction that's in place. So the Supreme Court majority didn't issue any written decision detailing the reasoning behind its ruling, but Justice Gorsuch issued a concurrence, which we'll discuss later on. Now, given that the lawsuits challenge the formal rulemaking of a federal agency, the claims made sound primarily under the APA, the Administrative Procedure Act. The landmark APA case, of course, is Chevron USA versus Natural Resources Defense Council. And Chevron provides for a two-part test. Chevron Step 1 asks, has Congress directly spoken to the precise question at issue? If so, Congress's intent controls. If Congress has not spoken directly to the issue, then Chevron Step 2 asks whether the agency interpretation is permissible or reasonable in light of the underlying law. So this is really a process determination. This is a highly deferential framework, and it gives a lot of leeway to administrative agencies in general. That said, there's been a push recently towards limiting agency action and agency discretion. So here are the main challenges that the plaintiffs make under the APA. For Step 1, the plaintiffs argue that the rule is contrary to existing law in a number of respects. They look at the longstanding definition of public charge, both through the INS field guidance and prior to that. They look at other congressional action. So you look at the INA, you look at ERIRA, WARA, the Rehab Act, and they say that prior congressional action precludes this rulemaking by DHS. For Step 2, the plaintiffs really challenge the process in which DHS went about its rulemaking. They say that there was inadequate justification for why the rule had to be made in the first place. DHS didn't adequately consider the cost and benefits of the rule. They failed to look at all of the over 200,000 comments that were submitted. So getting into these arguments a little bit more deeply, the first argument that the plaintiffs make is really definitional. They argue that the term public charge was commonly understood to mean primarily dependent on the government. And they cite first to a bunch of dictionary definitions, but as you can see, the defendants were able to find other dictionaries, right? They're looking at other sources that support their position. The plaintiffs also contend that the rule conflicts with other congressional action. So for example, PROWARA, the Personal Responsibility and Work Opportunity Reconciliation Act, expressly permits certain qualified immigrants to use public benefits. And so they argue if Congress really had intended to exclude all immigrants from using benefits, Congress certainly had the opportunity to do so. They also allege that the rule violates the Rehabilitation Act, which prohibits any program that receives federal assistance or that's conducted by an executive agency from excluding or denying benefits to or otherwise discriminating against persons with disabilities. And because an immigrant's disability status is a negative factor under the totality of circumstances test, the plaintiffs argue that the rule violates the Rehab Act. Similarly, the plaintiffs argue that Congress previously rejected a number of legislative attempts to redefine public charge along the same lines as this rule, and that those rejections really speak to Congress's intent to maintain the prior meaning of the term. So for example, Congress rejected the 1996 Immigration Control and Financial Responsibility Act, which would have altered the meaning of public charge to include non-citizens who used almost any benefit program for more than 1 year with limited exceptions. In 2013, Congress also rejected a proposed amendment to the Border Security, Economic Opportunity, and Immigration Modernization Act, which would have expanded the meaning of public charge to include those likely to qualify even for non-cash employment supports like Medicaid and SNAP. In 1996, Congress rejected provisions of the Illegal Immigration Reform and Immigration Responsibility Act, IRIRA, that defined public charge to mean 12 months of benefits usage within a 7-year period. And the bill also expressly included Medicaid, food stamps, and housing assistance programs. So if those kinds of factors sound familiar to you, it's because they are really, they mirror some of the ways that the new rule redefines the term public charge. And the plaintiffs argue, look, Congress already looked at these kinds of definitions and they specifically rejected these prior attempts to legislate around this issue. Now, DHS's position, not surprisingly, is contrary, right? They say that Congress intended to delegate to DHS the authority to define this term, and that Congress's inaction, right, refusal to pass legislation, doesn't work as a withdrawal of that delegation of authority. And it's also not an endorsement of any particular meaning for the term public charge. So moving on to step 2 of the Chevron analysis, the plaintiffs argue that even if Congress didn't speak directly to the issue, the rulemaking, the process, was arbitrary and capricious. Some of the reasons referenced by the plaintiffs for this include that the rule doesn't actually reduce immigration incentives. That's because most immigrants aren't eligible for benefits enumerated in the rule anyway, and immigrants aren't basing their decisions to immigrate on the availability of public benefits, after LPR status and, 5 years down the line. The rule also doesn't promote self-sufficiency. Health, nutrition, and housing programs actually boost the ability to work, right? And removing them harms the rule's stated goal of promoting an individual's ability to sustain himself or herself. The weighted factors are also irrational and unpredictable and difficult to apply. So, for example, including something like the English proficiency factor in the totality of the circumstances test doesn't actually tell you anything about someone's ability to be productive or self-sufficient. There are plenty of people who wouldn't pass an English proficiency test who have been able to be plenty productive here in this country. And finally, plaintiffs contend that DHS didn't adequately consider the comments that were submitted during the rulemaking process, over 200,000 of them, most of which were highly critical of the rule, and many of which spoke to the chilling effect that Holly discussed earlier. So by and large, while some of the district courts that considered these issues, they picked at other legal issues like standing or the scope of the proposed injunctions, they all mostly agreed with the plaintiffs on the APA claims. But not so with the circuit courts. As you recall, the 9th and 4th circuits both stayed the injunctions by the lower courts in their regions. And because the 9th Circuit is the only appellate court that's issued a decision so far, we'll spend some time with it here. On Chevron Step 1, the 9th Circuit opinion finds essentially that the term public charge is ambiguous and that Congress intended to vest discretion in DHS to define the term. As you can see from these quotes, the court refused to read into Congress's history of rejecting legislation that was substantially similar to the rule. 9th Circuit writes, unlike the district courts, we're unable to discern a fixed understanding of public charge that's endured since 1882. And the failure of Congress to compel DHS to adopt a particular rule is not the logical equivalent. It's not the same thing as forbidding DHS from adopting that rule. Finding that the meaning of public charge is ambiguous, the court moved on to Chevron Step 2. Was the rulemaking arbitrary and capricious? And here, the 9th Circuit, again, easily finds for the defendant. The rule easily satisfies the requirement that agency regulation be reasonable or rational and consistent with the statute. and it suffices that the new policy is permissible under the statute, but there are good reasons for it, and that the agency believes it to be better, which the conscious change of course adequately indicates. So the court notes really that the arbitrary, the arbitrary and capricious scrutiny is not a particularly difficult standard to meet, especially in a case where Congress has provided an express grant of authority for the agency to engage in rulemaking. Now, even though the Ninth and Fourth Circuits granted DOJ's stay request, the Second Circuit did not. So there was still a nationwide injunction in place issued by the Southern District of New York. As a result, DOJ appealed the remaining preliminary injunction to the Supreme Court, and there, in a 5-4 decision, the 5 conservative justices voting to grant the stay, while the 4 more liberal justices voted to deny, that there was no written opinion. Right? So we don't know the reasoning behind the court's decision. That said, Justice Gorsuch issued an interesting concurrence that disapproved of nationwide injunctions in general. Joined by Justice Thomas, Justice Gorsuch writes, the real problem here is the increasingly common practice of trial courts ordering relief that transcends the cases before them, whether framed as injunctions of nationwide, universal, or cosmic scope. These orders share the same basic flaw, that they direct how the defendant must act toward persons who are not parties to the case. So the court here was really looking at lawsuits filed by states like California or New York, right, that have the effect of providing for these nationwide injunctions that extended beyond the borders of those states, the constituencies of those states. Now, I did want to take a few minutes also to highlight one argument made in the Washington case, which we discussed at length in our amicus brief, that the Ninth Circuit really doesn't spend a whole lot of time with, but it does reference it in this footnote. It reads, the Eastern District of Washington also held that because the states have a central role in formulation and administration of healthcare policy, DHS acted beyond its congressionally delegated authority when it adopted the final rule. The court then brushes aside the argument, citing the Congress's plenary power to regulate immigration and the agency's prior promulgation of the field guidance. But I think this analysis sells the argument a little bit short. The issue isn't whether DHS has the authority to promulgate immigration rules, because as we saw previously, the INA provides that it does. The issue really is, while Congress has authorized DHS to craft immigration policy, its discretion should be exercised in accordance with prior congressional action, including Congress's delegation to an entirely different agency authority over healthcare policy. Congress has also heavily legislated in the healthcare space, including with respect to immigrants, and has created a federal framework that allows states to decide for themselves how to structure their health systems. So states like Massachusetts and California have decided to use that authority to provide healthcare coverage through their state Medicaid systems to as many people as possible. And this includes qualified immigrants under PRORA and is intended to stabilize healthcare spending through increased coverage. The Department of Health and Human Services, through the Centers for Medicaid and Medicare Services, have expressly endorsed these state programs through authorizing state Section 1115 waivers, which in essence approve of the state approach to extend healthcare coverage as a matter of public policy. So the real question is, what happens when DHS's regulation in the immigration space transgresses prior congressional action and even intrudes upon health policy in this really complex, highly regulated area in which DHS has no expertise? The FDA versus Brown and Williamson tobacco case speaks to this exact situation. At issue in this case is the FDA's formal rulemaking to regulate tobacco under authority granted by the Food and Drug and Cosmetic Act. Brown and Williamson, which is a tobacco company, challenged the FDA as acting outside of its congressional grant of authority, despite the act's general grant of authority for the agency to regulate drugs and devices. So the statute says the FDA has the ability to regulate drugs and devices, and it provides a general grant of authority. Here, the Supreme Court ultimately sides with the tobacco company and against the FDA's exercise of its authority to regulate tobacco. In its analysis, despite the clear wording under the Food and Drug and Cosmetics Act, the court looked to Congress's prior legislation in the tobacco area. Specifically, the court focused on Congress's legislative actions over tobacco and the agency's previous regulatory restraint. The court also looked at Congress's history of rejected legislation that would have expressly given the FDA authority to regulate tobacco. So reading into this history, the court held that Congress had created a distinct regulatory scheme that precluded the FDA's regulatory action. So in the public charge context, we have a pretty similar general grant of authority under the INA to the Secretary of Homeland Security to establish regulations relating to immigration enforcement. But we also have this highly regulated subject matter in healthcare, where Congress has passed numerous pieces of legislation, including the ACA, PWORA, CHIPRA, and also including where Congress has specifically rejected legislative attempts to define public charge the way DHS has in this new rule, and also where the federal government has endorsed state attempts to expand coverage to immigrants like in Massachusetts and California. So this argument should also appeal to the conservative majority in the Supreme Court in that it's ultimately a conservative doctrine that an agency's discretion is limited to its congressional grant of authority. It also implicates the non-delegation doctrine, which Gundy versus the United States explains requires that a delegation of authority is only permissible if Congress has made clear to the delegee the general policy that the delegee should pursue. In other words, an agency doesn't have just a general unlimited grant of authority. And this argument was successfully made and referenced by the District Court of Oregon in the Doe versus Trump case, which enjoined the presidential immigration proclamation suspending entry of immigrants who lack health insurance. So as you saw, the Ninth Circuit didn't really make any attempt to reconcile these competing regulatory schemes. All it did was to cite to Congress's plenary power over immigration and the general grant of authority through the INA to the Department of Homeland Security. But I think cases like FDA versus Brown and Williamson and Gundy versus United States are really instructive here and should hold some appeal to a conservative-leaning Supreme Court, particularly where DHS's regulatory action strays outside of immigration and into matters of healthcare. So stay tuned. We expect that much more is going to be said about these important issues, and here's my contact information. Please feel free to reach out to me directly on any of today's topics.
Thank you so much to all of our great panelists today. I think that there was so much information, and I hope all of you learned a lot. I know I did. And I would like to open it up for questions. If you have any questions, please type it into the box as you see here on your screen. You can select, open the Q&A panel, select all panelists, and then type in your questions. For now, while we wait for some other questions to come in, I'm going to start with some of the initial questions we've already received. First, we have a question for April. Does this rule affect refugees as well?
Thank you, Leela. So as Holly and I discussed, there are certain individuals that are exempt from the public charge rule, and refugees are a group of individuals that are exempt. So they are not, when they're seeking to adjust their status, they are not subject to the public charge determination. Other examples that I mentioned, asylees, T visa holders and applicants, U visa holders and applicants, VAWA self-petitioners, and special immigrant juveniles, and others specified in the rule. But as Holly discussed, and maybe Holly, you want to say more about this, they're impacted to the extent that it's having a chilling effect on their use of benefits, even though they're exempt.
Holly, did you have any comments you wanted to add?
Sure. Yeah, I would just add, I think it's kind of especially troubling to see that the chill is extending to these groups, and it shows the disconnect between, the rule may be written a particular way, but that doesn't mean that people aren't interpreting it another way. Doesn't mean that people aren't receiving a lot of misinformation. And then there's just generally a lot of fear. And these are groups that are already, very vulnerable. That's the reason that they're eligible for these visas is because they've experienced some kind of crime or trauma or trafficking. And so these are the folks who, in some ways really need these programs to thrive and for their families to thrive. And so, I would just add that it's particularly troubling that we're seeing chilling effects among these individuals.
Thank you. Holly, we have a question for you. What are some of the long-term implications of the findings from the report?
Sure. I think especially thinking about the children who are being impacted, U.S. citizen children and mixed status families, for example, I think children and immigrant families represent something like a quarter of all U.S. children. And we also know that children in immigrant families live in poverty at higher rates than children in non-immigrant families on average. And so when we think about the threat posed by increased food insecurity, reduced access to health care, could really have kind of detrimental long-term impacts across the life course for a really large proportion of youth living in the United States. And then another thing I would just add is that, we think about the social determinants of health, and immigrants often already face existing structural barriers to health care and benefits programs, and there are a lot of stigmas. So these chilling effects are coming on top of a lot of already existing barriers that these populations face.
Thank you very much. We have another question that's come in. When a child is a U.S. citizen and the parents are not U.S. citizens, how do parents go about signing up their children for services and not put themselves at risk? April, if you want to maybe take that first, and we can share with the rest of the panelists.
Yeah. So under the final rule, when in that kind of situation, if for example, the parent signs up the child for CHIP, that would be an example of a benefit that is not a public benefit. And then the child, as a U.S. citizen and not the applicant for a green card, their use of benefits under the final rule should not come into play. I think the concern comes in for people in terms of the chilling effect, which is that if we go back to the totality of the circumstances, the immigration officer can consider all factors or circumstances bearing on the ability or potential ability of the applicant to be self-supporting. And I think that's, although technically the use of the children's benefits doesn't count, that might be an area in which people are concerned about, that it might indirectly come into play.
Justin or Holly, did you have anything to add?
Well, in terms of state benefits like Medicaid, these are state-governed programs, right? So the mechanics through which individuals would sign up for these programs really are governed by state systems. So in Massachusetts, for example, right, there's a separate registration process for Medicaid for adults and for children. And so when you're signing a child up for Medicaid, you're not necessarily going to see anything about the adults, the adult parents' immigration status. but all of this is incredibly complicated, right? And I think what the research about the chilling effect points out and highlights is just that this is tough for professionals, for people trained as lawyers to unravel, including people who have specialized healthcare expertise or specialized immigration expertise, because it really requires both. You're looking at the overlapping spheres of two tightened regulatory schemes. One immigration on the one hand and healthcare on the other, right? And while people are well versed in one, they may not be in the other. And so when immigration questions arise, healthcare lawyers aren't necessarily the best people for to be providing advice about how something's going to be affecting immigration status, but at the same time, they need to be providing advice regarding healthcare and how to access healthcare programs. So this is incredibly complicated, and immigrants who are in this process are tasked with not just understanding the complexities of this rule, but really they're looking at the overall actions of a hostile administration that's taken a number of immigration actions that have curtailed immigrant rights. So, I think as advocates, we and other organizations who are doing similar work to ours have certainly heard the stories that Holly highlighted earlier. These are definitely issues that our clients have been presenting to us, and the trick, I think, or the difficulty here is how do we communicate clearly to folks? How do we reach folks, in their communities when a hostile environment, I think, is pushing folks further underground and away from resources.
Thank you. Justin, I have a question for you. Why did DHS add use of benefits in the rule that those that don't have a green card can't access? What was the point of that? Was it in hopes that it would cause a chilling effect?
Yeah, I think that there's some speculation about that, right? Because in some ways, the rule is really quite circular. You have, as one of the enumerated, or as one of the heavily weighted negative factors, it's this concept that you can't use these benefits, and there's 12 months of benefits utilization in any 36-month period. But the reason why I say that's circular is because that is both a negative factor in the totality of the circumstances test, and it's also the objective of the test, the ultimate objective of the test period, right? The whole goal of the test is to determine whether somebody is going to be a public charge, which includes, which really means now at this point, whether somebody is going to use 12 months of benefits within this 36-month period. And so the whole test itself is a little bit kind of circular on itself. But I think the point to focus on is that this is a future-looking, it's a prospectively focused test. And so, the government makes this point in some of the briefs because the plaintiffs call this inconsistency out, right? They say that this rule, this test doesn't make any sense. Not only is it difficult to apply in this context, it doesn't seem to apply to anybody at all. These folks, who are, there isn't going to be anybody who's really going to be eligible for these benefits, or just a really small number of folks who would be encapsulated by this rule now. The government makes the point that, because this is forward-looking, just because somebody is not eligible for benefits today doesn't mean that they're not going to be eligible for benefits in the future. And so really what the immigration official is tasked with at this point is looking ahead to see whether other factors bear on the question of whether or not this individual is likely to use 12 months of health benefits within a 36-month period at some point in the future. And that just becomes this really kind of impossible task, right? And it's so highly discretionary. I mean, I think in some ways in your most kind of cynical moments, you almost have to assume that the government's point in all of this is to instill fear, because it's difficult to conceive of another rational explanation for it.
And I just want to also add that, DHS in its comments to the comments, they basically say that when in addressing the concerns about the chilling effect and disenrollment, that they're not going to take into account people's unwarranted decisions to disenroll in formulating the rules. So they kind of just disregard that huge concern that was raised by a lot of people.
Thank you. We have another question. Does the public charge rule apply to state-funded only Medicaid benefits or benefits under a totally state-funded housing benefit? I think we'll start with April.
Yeah, so the public charge rule applies to, as I had mentioned, most forms of Medicaid. It does exclude emergency medical, Medicaid used by children under 21, Medicaid used by women that are pregnant or 60 days after their pregnancy, and Medicaid-funded services under the IDEA. In terms of the housing subsidies, those include the Section 8 housing assistance and the Section 8 project-based rental assistance.
Thank you. Holly or Justin, did you have anything you wanted to add?
No, not on this end.
Nothing here.
Great, thank you. That is it for our questions for today. If there's anything else our speakers would like to add, we have a few minutes. Any last words? Okay. Justin or Holly, is there anything you'd like to add for the participants?
No, I just wanted to thank everyone who's arrived and listened in. This is such an important topic, and hopefully we can figure out a path forward for folks who are vulnerable and most in need of these kinds of services.
Yeah, I would echo that. Thanks everyone for your interest in this difficult and constantly evolving issue, and I think we all just have to stay tuned on the litigation that Justin laid out so clearly.
Thank you so much, and thank you to all the participants and to our panelists for joining our Public Charge Rule and Threat to Public Health webinar. You'll receive some information about CLE if you're interested in receiving CLEs, and there's a survey also at the end. If you don't mind completing our survey, it helps us prepare for future webinars. Thank you again to all the panelists and participants. Have a great day.